Hi, Team NHFT. Today's International Nurses Day. Every nurse across the world, not just the UK, will be celebrating International Nurses Day. But for me, it's wider than nurses. It's about our AHP colleagues as well. So it's about all of us. It's a big thank you to you for everything you've done during the pandemic. And I'm so proud of you all. You know, this video is about asking nurses and AHPs what they're proud of in their professions in the last 12 months. But for me, I'm proud of you all. You know, we're celebrating the diversity of nursing and AHPs across this trust today. Actually, it's just a big thank you to me, to Team NHFT. Can I ask you, over the last 12 months, what's made you proud to be a nurse?
For me, it's about being part of something bigger. We've usually, you've got your 0 to 19 team, and you've got your community beds, and you've got your various aspects that make it NHFT, and we work very much within our specialisms, I suppose. But during COVID, it's that sense of everyone having to pull together to get the best outcomes for the various sort of populations that we serve. We've shown how resilient we can be as nurses. We've shown how transferable our skills are, because you can, for me, working in one specialism for such a long time and then being told I was going to be redeployed back to Daintree Hospital, where I came from originally, was terrifying for myself and a lot of other colleagues. But we realised we hadn't lost our clinical skills. We felt that we were making a difference in that time. The pressure on the acute beds was high, and nobody knew when the community staff were likely to be pulled into the hospitals, and actually that made, we felt like we were making a difference. And all the time we were there, the 0 to 19 team was then working on ways to enable us to be able to do our job effectively, using Teams, doing things virtually. We were very aware of our vulnerable families, our vulnerable children, and we just picked up, I suppose, and carried on supporting them. Lots of different innovative ways, and it's been a real steep learning curve, I think. Lots of things will remain.
What my question to you today is, what has made you proud to be an allied health professional working over the past 12 months?
What's made me proud is we've worked patient facing the whole time, and I think although our service completely changed and what we did, and we had to completely adapt to a new way of working, but we came together really nicely as a team, and I think it showed actually how strong we were, or still are, as a team.
Well, what's made me proud to be a nurse? Well, as you know, nursing is a profession that's always giving, and I haven't been able to perform the full role, responsibilities of my role in the last 12 months, only the admin side of it, because I've been shielding. But what's made me really proud is the fact that I was involved in piloting and launching the Trust COVID risk assessment. So I was quite involved in creating the document and also piloting it. And also as well, what's made me proud is I became a COVID-19 vaccination champion. And I've been involved in quite a few community events, which has been promoting uptake of the COVID-19 vaccine in all Black and ethnic minority groups.
Okay, so over the last 12 months, I've been involved in 2 different roles. So my first role is I'm a learning environment nurse, and I've been able to support some student nurses through the last 12 months, which has been very different for those. And we've watched some nurses qualify and become our own nurses within our own teams within NHFT. For the last 3 months, I've been involved with the COVID vaccinations for our housebound patients and for our inpatient patients, so our community bed patients. And this has made me really proud to be part of NHFT, to show that we can work with outside organisations and with our own wards to provide our patients with the COVID vaccine. The team has worked incredibly hard over the last few weeks, and especially over this past period of getting the second vaccines out under so many different restrictions with vaccine changes, etc. So I'm proud of those, and I'm proud to be part of this pandemic and be part of giving the patients their vaccines. So the last 12 months has been very different. Very, very different, but very proud of both aspects of my role.
Over the last 14 months, what I've been most proud of is first, our service. We've continued throughout. Throughout COVID lockdown, we've learned to adapt quickly and to use technology, and we've never missed one day. So between us, ourselves and our patients, we've managed to adapt and carry on. Our level of access and our recovery rates have never been better.
Leonie, what has made you proud to be a speech and language therapist over the last 12 months?
I think I've been immensely proud of being a speech and language therapist in the way that we've adapted to the new ways of working and tweaked the old ways of working, because while we moved into using telehealth and telephones and video calls, we also still had to do some face-to-face, especially in the acutes, and with that meant lots of PPE and following the infection control guidelines. So yes, it's been immensely physical and emotionally draining at times, especially when we're on ITU, but also immensely proud of the way the staff have supported each other and helped each other's mental health and well-being.
Well, as we all know, Julie, the last 12 months have been quite challenging for everyone with the pandemic going on. I was in a different role. I was a ward manager for a low secure service, and it was quite challenging when the pandemic came through. Our patients are obviously restricted as it is. So with the pandemic coming through, we had to have more restrictions. So as a team, I was leading the team. I had to be very pragmatic and very creative in how we could support the patients. And I have to say, we were the first unit to get positive cases in the trust. 2 cases. I have to say there was a lot of anxieties within the team and the patients, but I'm very proud that as a team we managed to contain the virus to those 2 cases. I was in the front line. I didn't let my staff do the work. I was there. They saw me getting involved, and I was really proud how the team pulled together.
Hello, Julie. Thank you for joining me for an impromptu video, because I hear we've had some good news.
Yes, I have. Yes, Ruth May presented me with Chief Nurse and Officer Gold Award this morning. Actually, I was awarded this award for my work in the trust as a senior leader, my leadership during the run up to our 2 outstandings of the CQC, all the work there, and also my leadership during the pandemic. I was shocked. It brought a tear to my eyes.
Yeah.
But for me, it's not about me. It's about Team NHFT. You know, it's all the nurses and the staff out there who do, you know, they're there every day, stand up and be counted. They've been amazing through the pandemic. So it's really for the team.